This interview is brought to you by NTT Data. NTT Data delivers on your mission by combining superior talent and over 55 years of government expertise with a comprehensive portfolio of technologies from cloud, security, and consulting to modernization and IT solutions. We're your ideal partner for reimagining your healthcare IT. Visit nttdataservices.com.
We're here at HIMSS with Andrea Fletcher, Chief Digital Strategy Officer at CMS. So good to be here.
Yeah, it's great to be here. It's a little overwhelming. This is my first time at HIMSS, and I have to admit, like walking through the show floor, I was like, wow.
Did you see like the three different wings of rooms yet?
Yeah. Government's kind of off to the side over here. But then we were at the keynote this morning, which was also like an actual song and dance.
Yeah, it was amazing. But you are speaking on a session, Teaching the Elephant to Dance.
Yeah.
What does that mean?
So when I started talking about digital transformation and digital strategy at CMS, obviously I did a little online searching to see how people talk about this. And I kept coming across this phrase, teaching the elephant to dance. It's both from a business management, how to do change management, but then also the tech sector uses this phrase. So my interpretation of it is, the elephant in the room. Sometimes it's a really big organization. I would say the federal government is a really big organization. And how do you teach an organization to be agile, to move quickly, to be nimble? What does it mean to teach the elephant to dance, to tap dance? And so I think about that often as I'm trying to figure out how are we, as the federal government, doing digital transformation internally, but also in the healthcare space. How do we do it fast? How do we do it in a way that is secure and safe, but also agile and changing constantly in a changing space?
Absolutely. I'm looking forward to hearing more because I know you have all those answers.
I needed a catchy phrase to stand out as well. I was like, that'll do.
So where are you seeing digital services make the most impact right now at CMS?
Yeah, at CMS, I think we're delivering on a lot of ideas that people have. So, somebody will come to us and they'll say, we've been thinking about this thing for years sometimes, and we just start piloting or we start building. That's really been our strong point, is that we have software engineers and designers who come in and product managers who come in and can build the thing. And so we're doing a lot of piloting, a lot of testing, a lot of validating that this, actually is a good idea, and we should go build the big thing. And that's kind of been our sweet spot, I would say, over the last year. So we've been doing a lot of stuff with open source. We've been doing a lot of stuff around the new National Directory of Healthcare. We've been working on legislation like the Inflation Reduction Act. So we're doing several different projects where we're coming in to test the hypothesis before we go, build a giant system somewhere.
Awesome, exciting,
it's fun,
but very much needed, especially for such a huge.
It's agile. It's a dancing elephant. I would say.
Absolutely, there's the elephant in the room. So we're here at HIMSS. What are you hoping to learn, or what are some of the things that have stood out to you so far?
Have you heard of AI? There's a lot of AI. I'm looking to learn how is healthcare, how are providers, how are hospitals actually using some of these tools. What does this look like in a hospital? I have been to hospitals recently, and I haven't seen as much of it from a patient perspective. So I'm trying to understand, what does this actually look like as a patient comes in, to an ER? What is the AI really doing?
Sure.
How are we going to see the benefit of that for patients? And then as Medicare is the largest payer, how do we need to regulate that? How are we going to pay for some of these tools? Everybody wants their virtual doctor to be paid for by CMS. And what is it going to look like for us as we roll out over the next 6 months to 2 years on trying to actually realize these cool gains for the general public?
There's a lot of potential there for especially the payer side of things. So that's exciting. So partnerships are really critical here. The show is all about that. Has there been any area where you've seen partnerships make the most impact?
In the government space, we partner with other parts of HHS, or we partner with Veterans Affairs, right? So I think that's been really interesting.
Has there been like an area of technology or digital services where it's been really helpful to kind of have some of those external.
I would probably say the open source work that we've been doing is where the rubber meets the road on that, because it is, putting software out there, putting technology out there that is open to everyone to use, and then also how we're bringing in open source tools is kind of the other side of it. So it's both intake and output. And we were actually, CISA, I haven't seen CISA, but I think they're here. I got to meet with a bunch of their open source people a couple weeks ago in the open source community, I guess last week, not a couple weeks ago. And we had an awesome chat just about the foundation of all of this software is actually open source software that is being freely maintained by foundations and package maintainers and small groups of people. And that has been a really interesting community to be a part of. Because it's the foundation of the internet. The internet was designed to be free and open. And so that's been a really interesting partnership and an interesting area to move into as the government and as CMS, because we have the first open source program office in the federal government. And I think if people are a little surprised when they hear it's at Medicare, we kind of get these looks you guys are doing what? And we're yeah, it's super cool. And it's an interesting space. You can see all the technology here. So, at CMS, we need to be able to work with as many people as possible.
Definitely.
Yeah.
So AI, cyber, open source. So I think we got it all in there.
Yeah, all the really easy things to do.
Awesome. Anything exciting ahead?
This year, we have a lot of exciting stuff happening at CMS. I think the biggest thing for us is that we've been bringing in a lot of early career talent. So we have 4 digital core fellows right now. We have 2 more coming in. We are working with Coding It Forward to bring in interns this summer. We're potentially doing some work with Baltimore City Schools, bringing in interns. Yeah, technology interns.
That's amazing.
So I get really excited about all of the young people who are coming into CMS to help us, transform.
They're the future.
Yeah, they are the future. And, I think of where I want CMS to be in 5-10 years. I'm we need to bring in the next generation of civil servants, of leaders, of people who can build and use this technology and understand it.
Awesome. Well, thank you, Andrea, for being here at HIMSS and chatting with me.
Yeah, thank you so much. Bye, everyone.